Excuse me. Hello, everyone. Welcome to another edition of Grown Folks Business on a Thursday evening. I hope you all are doing well. We still are dealing with the remnants of daylight that we have left before fall is upon us. So enjoy it as much as you can. But for those who are gathered in this space, I appreciate you. Those in the boxes, as Brother Mike says, these little boxes. If you're here, generally it's because we have some good common thoughts and ideas about how we want to see the world, or you have something you want to share. Tonight is one of those nights we have some people that want to share some things, and two guests, Jasmine C. and Lindsay Yelksheimer. I probably should have got. Did I say it right? Oh gosh, I got. So my last name is complicated also. That warms my heart that I got that right. So welcome you two. I know this was a kind of a different episode as far as tonight goes. We had a clear and concise topic that was prompted by the desire of you two to come to the space and share a survey and also talk about some research you're involved in concerning what I titled the show, Black Americans versus American Medicine. So the history is clear. There have been a lot of issues inside of the Black American experience in regard to how they've been treated by the medical establishment. And I know some of what you're doing this evening is all of what you're doing this evening is with consideration of that, including the survey that we have put out in the email and the text that is sent out about the show this evening. So I'm going to allow for Merrill to introduce you to. He has a little bit more knowledge of where you guys come from and how you guys came to be affiliated with us. And then we'll transition into you guys giving us your spiel. I know, Lindsay, you'll be the primary person speaking, but we're here for it. So welcome, first and foremost. And I'm going to let Merrill take over and do some introductions.
All right. I'll be very brief before letting Lindsay and Jasmine kind of take over, just to give you guys a little bit of context of how we were able to get in contact, and Lindsay and Jasmine were able to join us. Back in 2018, Blue Cross Blue Shield Foundation came up with some funding to support more collaboration between the folks that do healthcare work and nonprofits within Rockingham County. And it was a program that was that basically is facilitated by UNC Family Medicine. Trying to get together with institutions that have resources and want to support all folks in Rockingham County in getting access to preventative and primary care. And we call it the ROC PCI Collaborative. So at the very beginning, as you can imagine, there weren't a ton of grassroots organizations that were involved. It wasn't the most diverse group to begin with. And over time, it's been a little bit more diverse. It's had more conversations about organizations having equity and inclusion lifted up as like part of their work, because this work can't be done. We can't have real population health in our communities if we don't have folks in leadership positions that represent different communities, and we aren't having conversations with folks and moving as directed. So in 2020, especially during the pandemic, there were some conversations that NC 100 was able to have along with Regional Area Foundation with UNC School of Nursing. And there were a couple of students who were working on their master's project that wanted to specifically do some work in rural communities. So we first kind of introduced this idea of kind of doing some direct survey in the community, but particularly trying to focus on Black American communities. And since then, we, in collaboration with other groups across the Rockingham County and other places, have been doing work to kind of find out what some of those barriers are, or talk about it and get some instruction. And so this is a second iteration of that. doing this survey work to kind of take that feedback back to the powers that be, look at the literature that we're getting out there, looking at the methods, looking at the outreach, and just kind of dealing and coming to grips with some of the real, dealing with the historical pieces, why there's medical mistrust, and figuring out ways for us to just get more information. So it's very important that folks get a chance to fill out this survey so we can act and move as directed. So with that being said, we'll let Lindsay talk a little bit more about the survey and go from there. So
thank you so much for having Jasmine and I tonight to talk about this. We really appreciate your time. Like Meryl said, I'm Lindsay, and I'm a student at the University of North Carolina in the School of Nursing. I'm studying to be a nurse practitioner for adults, specializing in primary care. And one thing that primary care providers are really passionate about is preventative care, screenings and immunizations and things like that. So our survey is basically looking at how medical mistrust has impacted the uptake of preventative care. So are people with high levels of mistrust reaching out for preventative care services? Do they trust their provider to give them the right information? Things like this. And we're specifically focused on the African-American community in Rockingham County for the reasons that Meryl outlined. So last year we started our survey and it went okay, but because of COVID, we weren't able to do as many in-person meetings. And so we basically relied on the online survey results, which was fine. But this year we'd like to get more results from a more heterogeneous group of people. So all sorts of demographics, Caucasians, Hispanics, African Americans, ages 18 and older, for those that live in Rockingham County. And what we have found is that, or what I have found in my own research, not associated with this particular survey, was that individuals that experience like a higher level of perceived racism or racism in general, actual racism, are more likely to have higher levels of medical mistrust. So they're less likely to go see the doctor if they feel like when they go in there, they're going to have something racist occur. And I'm also finding out that those with higher African Americans with health insurance and that are in a higher socioeconomic stratus are actually less mistrustful of providers. So there is some correlation between socioeconomic status, health insurance, and mistrust. We're not really looking at that. We are looking at those demographics in our survey. There's, I think, about 20-something questions that sort of get into those sort of aspects. And then Jasmine and I added a couple of questions this time around to the survey that kind of looked at some of the roots of the individual's mistrust. If they were able to pinpoint if they came from like a interaction with a provider that was negative or whatnot. There's a lot of areas to write other, and you can write about your own personal experience. And then finally, a question about how we can do better, how we can increase trust and build trust amongst our patients so that they are more likely to listen to what we say and trust us. I know that there's this long history of racism within the medical community, the Tuskegee experiments that were done for years and years and years. And then I think, Felton, you were going to talk a little bit about one of the books that you read. So there's a lot of reasons for there to be mistrust. And I think that as providers, particularly as a Caucasian provider, we need to work on sort of reversing this. And we're interested in figuring out ways to do so. I became interested in this research because I am a nurse in the COVID ICU over at UNC. And we're seeing a lot of vaccine hesitancy. We're actually seeing it all across the board. It's not just in the African American community. But I have noticed, and this is just anecdotal, I have noticed that the reasons that African Americans don't want to get the vaccine have to do with not trusting that the government has their best intentions in mind. I had one of my coworkers tell me that she knows some of her Black friends that think that white people are getting a different vaccine than Black people. Which is, it was just so hard to hear that, to think that that sort of, that exists, that it was very upsetting to me. And so for that reason, I sort of became interested in medical mistrust, vaccine hesitancy, things that sort of have to do with that. So it would be wonderful if we could get some more survey results. The link is provided. I think you send it out in an email. It's totally anonymous. It takes maybe 10 minutes, maybe less, depending on how quickly you can fill it out and how much you have to say. And again, it's for individuals of all races, ethnicities. You don't have to be Black to take it. And we're particularly interested in some of the comparisons between racial groups. I do know that last year, one of the things that sort of stood out that had any sort of statistical significance was that African Americans like to have a provider that is also African American, whereas white people didn't care as much. It didn't mean as much to them. So I found that pretty interesting. But yeah, if you're 18 or older, you live and work in Rockingham County, please fill out our survey. It would be so helpful. We could gather more information, be able to dissect it, and maybe actually come up with some solutions to the problem of medical mistrust, which prevents people from, getting the care that they need to prevent illness.
I greatly appreciate that. Well understood reasoning for you being here this evening. That was very well communicated. Jasmine, if you've got a good signal, you want to say a couple words also?
Yes, I'm so sorry. My phone keeps kicking me out. But just to piggyback off of what Lindsay said, it's obviously very important to understand if there is the presence of medical mistrust in Rockingham County. Just through research that I've also done, I've noticed that there are higher rates of some of those more chronic conditions that are pretty common. So like high blood pressure, diabetes, of course. And it's important to point out that all of these are preventable. And so if we determine the presence of medical mistrust and we're able to come up with recommendations to help improve those things, we can decrease some of the rates of those chronic conditions, and then we can just improve the overall well-being of the residents in your community.
Yeah, I think you guys are on to something that is highly important for the general health of our society. So I was glad to hear you clarify that there are hesitancies across the board as far as the vaccine goes. I think some moments that I've witnessed are over sensationalized in terms of which demographic is shunning the shot that may help you deal with COVID better. That does help you deal with COVID better. Let me say that clearly. I've been vaccinated. It does help you deal with whatever may be better. The science says that it works to help you not go as deep into some levels of the illness as you could without it. So yeah, I think it's very important to understand that Black folks get the vaccine. Black folks don't get the vaccine. White folks get the vaccine. White folks don't get the vaccine. This is across the board. There's conspiracy theories associated with this thing and everything else. However, we do have to make the concession for the history that exists that reflects the maltreatment that Black Americans have received from the medical society. The reasoning why these conspiracy theories still thrive in our community, so to speak, and why they're based in fact. And you mentioned the Tuskegee Experiment, where they were giving African-American men syphilis for a number of years. And this went on into the 1970s. And it was just to see how they would deal with the effects of having this terrible disease. And there was not an effort to really rectify that situation. It was something that just was understood as a something that happened. So that's an atrocity. And you think about those, that rippling effect, people who know about that history, people who had family members experience that history. Henrietta Lacks, I know people have probably heard The Immortal Life of Henrietta Lacks, but her cells were taken without her permission, without her consent. That's not a good thing. I was mentioning to Lindsay before we came on, J. Marion Sims. He's known as the father of gynecology, and it's known that he was experimenting on enslaved women, doing some atrocious and terrible things, and some of it was based on junk science that Black people could tolerate pain more. So he was doing things to these women's genitalia without anesthetic. Sure, it's wow, maybe we don't get to know what we know about the female anatomy without his work, but that does not lessen, to any degree, it doesn't lessen what he did while he was doing it. It's not okay. And the people that suffer the most are Black Americans who were susceptible and vulnerable, and remain so in certain instances. Whenever you see these things about work studies and such, a lot of times it's economically depressed people, which are gonna end up being reflective of the Black American community. So there's a whole lot of reasons that Black people are fearful of the doctor, just like anybody else. Nobody wants to hear bad news, but you also have to throw in that history and that legacy of maltreatment by this country. So first off, Jasmine, hopefully you are way more stable than you were before. So can you tell us why you got involved and why you decided to get in the healthcare industry and field, and why this this survey and this I think this is you guys, is it your thesis or is this a project? So why did you guys settle on this?
Well, I've been a nurse for 6 years. I've been in the ED, I've been in med surg. I'm currently an oncology nurse. Prior to obtaining my nursing degree, I got the degree in public health. And so, yes, this is our master's thesis. It's required for graduation, but obviously as an African-American woman, it's important for me, for my community, to be healthy. And upon graduating, the goal is to be able to provide that care as a nurse practitioner. But because we know social determinants of health is a real thing, it's a real factor and a real barrier to some people obtaining the care that they need. Being able to be involved in a project like this in order to understand one of those barriers, which is medical mistrust, I think it'll give me insight into how to go about developing programs and just creating opportunities and resources for patients and individuals in the Black community to improve their overall well-being.
That's awesome. I think half the battle of going to the doctor it takes place up here. Some of it's just based on, like I said, if something's bothering you, you don't want to get that bad news. My grandmother was that way. I can't say it was any level of significant medical mistrust, but she was not a fan of any any doctor, because she was hesitant about what they may or may not say, or what they may say that would be in the negative. Okay, yeah, the great post. You guys read that stuff. If it's something from somebody else, I'll read it. But that's a good post thing to share right there, Meryl. Lindsay, tell me your story. What made you decide to get in the healthcare field, and what makes this project special to you?
I got into healthcare because honestly, I just needed. I was teaching in Honduras kind of after college, I was a sociology major, and I was sort of trying to figure my life out. And I was doing a lot of traveling in Central America, and thought maybe I wanted to get into teaching, but I became really interested in healthcare because I kept getting sick from drinking dirty water in Central America. And I think I also just realized that I wanted to do something that mattered and that could really help people. And I felt like education or healthcare was the way to go. And I quickly decided I didn't want to teach in the US, but so then healthcare was my next option. And I had a really good experience with a nurse practitioner one time. And I was like, I think I would like to do that. So I went into nursing to eventually get in to become a nurse practitioner. And I'm really loving it. And I'm really loving the way that nurse practitioners can sort of treat the patient holistically, looking at things like social determinants of health, which I think are almost more important than anything else. If you have somebody who grows up in poverty and never has healthy food to eat, and grows up with trauma and they're abused from a young age, then they are going to probably try to cope in unhealthy ways with drugs and alcohol, or never take care of themselves in the ways that they should. And those things really matter. And so I think if you don't recognize the backgrounds that people come from, that you're really missing out on treating them as the whole person. And I think that nurses do a pretty good job of recognizing that. So I'm proud to be studying to be a nurse practitioner for that reason. There are really wonderful doctors out there that also are focused on these social determinants of health and how important they are. And then, like I said before, the working in the COVID unit made me, and just seeing how, like you said before, people of all different races are really, really nervous about the vaccine and do not trust the data that's out there or the science that's out there, and they do not trust medical professionals. Even some medical professionals don't trust medical professionals. It's like a very interesting time to be in medicine, and you would just be really surprised to hear the reasons. Some of the reasons why people don't want to get this vaccine are just completely bizarre. But some of them are really valid, and you're like, oh, okay, I totally get that, and I understand that. And so that is sort of why I became interested in mistrust in general. And then when Dr. Vernon Platt sent out the email, said that she was working on a project for medical mistrust, I was like, I want to do it. So I emailed her right away. And it's easier to work on something that is rigorous if you are actually interested in the subject. I will say that. It's the one thing that I've learned about graduate school. So I'm glad I'm here. And I'm getting to have these really amazing experiences with Facebook Live and then Rock PCI, and I'm going out to these communities. My mom actually lives in Stokesdale, so she lives in Rockingham County. And so I'm going out to these schools with these mobile food markets, and I'm getting to see her community, and it's really wonderful. So
that's awesome. I am very much in agreement with when you're doing these extra degrees, when you're going for the master's or the PhD, you better be interested in whatever topic you're having to write a paper or a thesis or a dissertation on. So I totally agree with that. And it sounds like you've seen some of the world, which I think is important. Even if that world is only a couple 100 miles away from where you live right now, you need to see other places. You don't need to spend your entire life within a 3 or 4 block radius of your home. Go see some other things. You'll be surprised what it may prompt you to do. At this point, I'm going to open it up some. Jay and Meryl, please feel free to come in. I'm going to read as best I can. It's probably going to be terrible, but I actually wrote a paper a couple years ago. It was not completely about medical mistrust. in the Black community. But one of the books, the one that I referenced earlier, was definitely centering on that topic. And it was people have that misconception about the Black Panther Party that originated in Oakland, California, that it was just about militancy and all about, taking it to the man, so to speak. But the Black Panther Party was about taking care of the community from a health standpoint just as well. They did a lot of training of nurses and nurse practitioners and providing medicines, sickle cell diagnosis, food, addressing food insecurities and things of that nature. And one of the books that I had referenced during this period of time was called Body and Soul, The Black Panther Party and the Fight Against Medical Discrimination. It's by Alondra Nelson. Very good book in terms of not just being about some of the political activities, but being about the desire to bring healthcare to the less fortunate, those who did not receive it. And one of the highlights was about the economic portion of it, something that has been referenced as we've been talking here by Lindsay. It's very important to keep in mind economics when it comes to healthcare, just as much as it is ideas around discrimination. So I'll read a quick part of this. You guys can be turning over whatever you're thinking. I thought this would be a good prompt, maybe for some more discussion. So I'll come to you, Jay Dwayne, as soon as I finish reading this small excerpt that I hope I don't stumble and bumble over. So in Nelson's Body and Soul, the role of the Black Panther Party is expanded beyond militant reaction to the white power structure. Nelson argues that the Black Panther Party was critical in addressing health inequality. In her observation, the party was concerned with the underserved poor Black communities and their lack of access to health care. So in chapter 3, titled The People's Free Clinics, she connects the efforts of the Panthers to address healthcare inequality in the Black community directly to the poor and lower classes in it. Nelson cites the case of an infant from the Brownsville section of Brooklyn, New York, dying from a lack of proper health care. The infant was rushed through the emergency room at the local hospital, bypassing a diagnosis and consequently passing away a few days later. It is not just the hospital's mistreatment of the infant, Nelson argues, that is culpable for the death, but also the class of neighborhood that the child lived in. She notes that Brownsville was a notoriously impoverished area, prone to garbage pileup and rodent infestation. The Black Panther Party newspaper reported that the flu virus and pneumonia were rampant in impoverished areas such as Brownsville. A lack of public access in terms of social mobility and class ascension was a fatal consequence of the families in Brownsville and their infant child. So again, like I said, I know it might stumble and bumble, but it's important when you frame that in terms of where they come from. Something Lindsay mentioned, where the person lives affects how they're going to receive treatment in a certain way, affects how they may be received by the people treating them. You ever go to the doctor or go to the hospital and, first thing they ask for is an insurance card sometimes. And if you don't have it, or if you might get that vibe like they don't want me here. So you're already off to a bad start. I kind of equate some of what we're talking about to going to a restaurant and having a bad experience. You just don't go back to the restaurant, right? Unfortunately, this is our health. You're going to need to go see somebody about something at some point. And we shouldn't have all of this static before we do it. So, Jay, you got anything you want to throw out there about this? Have you ever experienced anything regarding medical mistrust?
Well, yeah, my background actually is in healthcare. I work with even now special populations, but I have a background with psychosocial and drug addiction disorders. And so you see a lot of times that it seems to fit a certain race. Even when you advocate for treatment of care, it does matter what type of resources that you do have in place. Like, for instance, some people for instance, state type funding like Medicaid or Medicare, if you want to go to a federal level, because they put a cap on expenses. So naturally, they're going to go with the larger insurance providers because typically the cap is different. And even though they get money, they get more money for those out-of-pocket individuals. They treat them as less, but they can write those treatments off even more than those with insurance, but they treat people as if they were less. So one of the things I used to do in a lot of states that I worked in is when they said, a lot of people didn't know this, when you didn't have healthcare insurance, any hospital that received any federal funding could not deny the right to acute care. How this is set up is if there's a person that is working who received financial aid, that is a hospital that received federal funding. So even if it's a private entity, it still is an organization that received it because person is considered a corporation. And a lot of people didn't know that. And so when they say you don't have it, the very first thing you do is say, well, how much money do you have in your benevolence fund? That's money that they already have set aside to do that, to make sure it happens. And they tend to treat you differently when you know more about the operational side of healthcare than the medical side of healthcare, which we find out a lot. And that has been a theme throughout. And you talked about the Black Panther Party, but let's be honest, they started at the height of the eugenics sterilization program. When all of that was going on, they knew other things were happening where they had, once we made it out of slavery, they were literally sterilizing our Black men and women from 1927, allegedly, up until 1974. But it's still being questioned if it's happening now because for some strange reason, Black women are still receiving 2 times more likely hysterectomies than our white counterparts during their childbearing years. Between 18 and 44, that's when they're having these hysterectomies. So it's still happening. Serena Williams just talked about how she was denied care, and she's a multimillionaire. So it goes, I think that we try to target one area, but we forget how deep racism runs through the veins of America.
Great observations. And I think of the Panthers' attempts during that era as doing what we can. And, doing something is better than doing nothing at points. But you're absolutely right about the hysterectomy. And I know I heard a good piece, I think it was NPR, a lady, and their justification for doing this stuff. And this lady was from North Carolina. She was from North Carolina. She was They subjected her to a hysterectomy. I think she might have been a teenager when it happened. But the justification was something to do with her being slow or, mentally challenged. But it was not the case. And she is now in Georgia somewhere, living as best life as she can. But can you imagine the horror of having the ability to have children removed without your permission and without your consent? So Jay, you spoke on some really relevant things as far as tonight's topic goes. I appreciate you again having the ability to reach in your tool bag and speak to those points. And you touched on another thing that's something I witnessed, and that's the mental health care field, man, in terms of how Black Americans experience and navigate those waters is pretty atrocious also. Meryl, do you have anything you want to throw out there? Any personal experiences, anything you've witnessed?
Not a lot, other than, I've been having this conversation about, during our Rock PCI thing that Lindsay referenced, and I know you've had a chance to join that call at least once or twice, Felton. But one of the other conversations I started thinking about as everybody was sharing parts of what you shared, Jay, and what you said, Lindsay, about access to care and hesitancy and lack of providers in Rockingham County, especially for Black Americans that need and want their provider to look like them. There's not a ton of providers that are of color in Rockingham County. A lot of access to care sometimes is in the emergency room because folks don't have a normal provider or feel like they it's going to be too expensive to kind of handle something to be preventative. And so we have a lot of, there's the balance of emergency care visits is out of whack. And then a lot of folks don't know in Rockingham County, particularly with Cone Health, that folks are getting their care with a Cone provider or going into Andy Penn. Cone is a nonprofit hospital, so like there are funds for uninsured, compensated care options for folks that are necessarily worried about getting the right treatment and the right care for stuff. So folks just have to, the providers have to get out there. Folks have to be thinking a little bit about being preventative and having conversations. Or if you do have a healthcare provider and you feel like that person is not giving you the help and advice and treatment that you need, you have agency to reject that, get other opinions, or to push back. So all those things, all these conversations is they're just a bunch of different conversations under one big header. Healthcare is tricky.
Yeah, it almost sounds to me, you and Jay are referencing having some inside knowledge. It's almost akin to having been a car salesman and going to buy a new car. You know a little bit about the game. And if these people, which majority don't, have any knowledge of how to navigate the waters of getting good healthcare, quality healthcare, and feeling confident about who they're interacting with and how they're interacting, then yeah, you're starting from a position of almost it's not going to take much to make you turn around and walk back out the door. And then when you think about the bill that's coming, yeah, it's a discouraging thing.
Yeah, Medicaid's changing. I think one thing too, real quick, I'll just add is like I am glad that the conversation about all those social determinants is like a really high valued, uplifting conversation, and projects, organizations. There's funding that we have access to that is directly from different attitudes from funders about all of the things that lead up to your health outcomes, your environment, your interpersonal safety, transportation. I just love that is more of a conversation, and there are dollars going out there to organizations that are doing all that work. I really do think the work that we do in community development is connected to all those social determinants of health. So I'm glad that that's happening and people are actually lifting that up.
I have a question because, as I stated to Lindsay before, I'm definitely not an expert on the topic, but I would like to hear from Lindsay and then you, Jay, as far as if you know anything about this. Did we have this worked out better at some point in our history as far as healthcare goes? Did we have this worked out a little bit with a little bit less red tape, or am I wrong about that? Has it always been super complex? And when you mentioned that, Jay, that federal dollars impact the way that they have to deal with any, citizen, any patient. Hey, if that means something, can we do this differently? And yeah, we can talk about universal health care, whatever. Is there another way to approach this that makes more sense? And Lindsay, I'll start with you since you're kind of in the field and working firsthand. Is there a way to just do this better that we haven't done or that we came away from that was functional?
So I don't know the answer to your first question about whether or not it was ever easier or better, or if there was red tape. I do believe that there's a better way to do things. I think that I think that universal health care works in countries that are not as individualistic as ours. And I say that because I think that Americans have gotten used to a certain type of healthcare and the immediacy. You can walk into an emergency room, for example, and have a CT scan Sorry, my daughter's home. Hey,
Girl Scouts is so fun.
I'm so glad you like it. Can you just?
And I play.
It's okay. Yeah.
I love it.
Yeah, she sounds happy to be home.
She's very excited about her Girl Scout meeting.
Yeah, she's happy to be home.
Sorry.
It's okay.
But so I know that in other countries, like in European countries and Canada, where they have universal health care, that there are obviously pros and cons about it. One being that it's affordable, and that there are huge safety nets where people don't slip through. We have safety nets in this country. It's Medicaid, but it's not a great safety net. And I think everybody can probably agree with that. You have to basically spend all of your money and have zero assets to really qualify for it. People that are in the middle class or in the lower middle class end up, even with insurance, end up having to pay exorbitant amount of monies for basic procedures. I know personally, I feel that way. If you get sick or if anything bad happens to you, you get $1,000 bills with insurance, and it's really disheartening. So.
I just want to say, as a parent, we live for those moments with kids.
I'm so sorry.
Look, I don't have kids, but I'm familiar with them. The next time you want to talk to her, she's not gonna.
Oh my gosh! I locked her out. So if you hear her screaming and banging, then that's what's going on. But okay, so back to what I was saying. So when you deal with these universal healthcare systems, and maybe Dwayne, you sound like you know a lot more about this than I do. But you talk to these people and they're like, yeah, I haven't, there's a 7-month waiting list to get in to see my primary care provider. And I think that wouldn't go over very well in this country right now, because people have a demand for healthcare that's immediate. And they want to have, if they have a cough, they want to go get a CT scan, and they want to make sure that they don't have lung cancer right now. It can't wait. And they have that expectation because we have health insurance companies that and medical systems that are very high tech that can provide that sort of immediacy. When you deal with universal health care, you don't have that. And so you do have to wait longer for things. Now, the argument is whether or not the outcomes are any different. And I think that there's a lot of good research that says that whether or not you wait for 3 months to see your primary care provider, or you get in to see them now, in certain circumstances, particularly with cancer and things like that, it doesn't necessarily improve your outcomes. And so I think if we really want to push, the concept of universal healthcare, our mindset as a population has to change to not receiving things right this minute, right now, because I want them and I'm nervous. And I just don't know if we're ready for that yet. I think it would have to come with some tremendous sacrifice from individuals. And there's a lot of great things about this country, but it was based on this concept of individuality, which doesn't happen in some countries, like socialist countries. They have this sort of concept of communal living and more. I don't know what I'm saying, but basically we are in my mind a little too selfish sometimes to deal with what that would all mean.
Individualism is definitely baked into this country's DNA. However, when the rubber has met the road numerous times during our existence, we figure out new and inventive ways. And of course, Roosevelt, and why we have Social Security and a safety net at all, is because it is pretty much a bit of a socialist structure. And within that, when the universal human rights, what is the universal laws of human rights, whatever it is, when Eleanor Roosevelt was touting this stuff, healthcare was one of the things. Education was one of the things. Mm-hmm. We came away from those lofty and probably worthwhile endeavors because the country finds a way to, at some points, and they did it then, exclude Black Americans. So we're right back at the beginning of this thing, right? Black people didn't benefit as much as they should have from the Great New Deal or the New Deal. But some people were allowed to really tap into the American dream. So my whole response to a lot of that, Lindsay, is we don't have to do that the way that is not working well other places. And that's what trips me out when I'm talking to somebody about universal health care. It's always, well, over there, man, you got to wait 7 months. Well, we don't do it so you have to wait 7 months. But we should do something that means you could just go to the doctor if you're not feeling well. It's not as complicated as we make it, but I think a lot of people are counting money inside of these decisions, and that, yeah.
And that
Go
was
ahead.
the second part of what I was going to say, is that there are some very powerful voices from the insurance companies and pharmaceutical companies in terms of their lobbyists that don't want to see something like universal health care, because I think everything boils down to money in life. And if you just follow the dollars, the reasons why something doesn't typically work out with politics, even if there's a robust, call for it amongst the population, usually has to do with someone that's powerful stands to lose money. And so I think that there's a pretty strong lobby that would lose some money. And there's multiple lobbies that would lose money if we went in that direction. Even though, it seems like most people in this country are ready for some sort of answer. I think everybody's pretty fed up with the system as it is. And I think that everybody realizes that something needs to change. And kind of back to what you were saying, it doesn't have to be, on the spectrum of universal healthcare, waiting 7 months to see your doctor versus going to get a test done right now. There's got to be some sort of compromise in the middle. And I do think that can be done. And I think that it will be done. I think it's going to be slow, incremental changes, like with the Affordable Care Act. You saw some really good things come out of that. And I think it's going to be more legislation like that that'll eventually move the healthcare in the right direction. Yeah, but I think it's going to take a while, honestly.
Well, we're making it take a while. That's the unfortunate part. Don't get me started on the Health Care Act. Obamacare, not very good in my opinion. But I'll say this, before I transition to you, Jay, two things. One, I think the Russians beat us to space, right? They did Sputnik, but we went to the moon, so we can do better. We went to the moon first. We can do better in instances that we choose to invest the time and capital and all of the greatness of America in. And second thing might have escaped me, but bottom line, we don't have to overcomplicate this thing. And I'm by no means an expert in that. No, I can't tell you how much money is available for what, but I can tell you this was the second thing. We went from saying healthcare for all to saying everyone should be able to afford good healthcare. I don't know if anybody picked up on that, but there were many years that we were all about healthcare for all, universal healthcare. That stuff faded away, and now Joe Biden says, everyone should be able to afford healthcare. So that should tell you something. We don't have our own best interests at heart. Jay, I'm going to let you say a couple words, and Lindsay, we're going to let you take us out with a final statement. So, Jay, get your words in, man.
I definitely agree with actually both of you. The part that people are missing is the universal healthcare reform. So in order for you to reform universal healthcare, we must have had some level of universal healthcare, i.e. the one that we were talking about already. People had a right to acute healthcare. Yes, I do think things can be done differently. And I think the way that it can be done is that we change the way we insure certain people. Case in point, why can't we change our dependents? If I am working a job, I should be able to select a certain amount of dependents regardless of the familiar relationship. It should be, let me get this. So imagine how many people we know that are uninsured, can't afford it, but we possibly could carry them on our insurance. but it only has to stick to your immediate family or someone that you're taking care of. But imagine what that'd do for the economy. They don't want things like that to happen. The next thing is the healthcare model did change around 2009. It went from disease and diagnose to treatment and prevention. So because the focus shift, those with pre-existing diseases actually did fall further behind, because to be honest, it sounds cruel, but it's looking like, oh, let those die out and then we can prevent these diseases from ever happening. That's why more funding is going into prevention. So those who have experienced the poor healthcare model or the grunt of the healthcare model there are definitely leery about the new healthcare model, because if they have pre-existing conditions, they are not considered part of this model. They're considered a burden to this model, which is why certain things are not happening. And we have to realize this is all still new. And so people are being affected, and it is a political game, but it is one that also relies heavily on knowledge. And if they will take advantage of those who are not knowledgeable of the things that are out there. And unfortunately, we're living at times where we can't afford to be ignorant, because the other thing is they started focusing, because it's a litigious society, they started to focus on specialty. So somebody can have hypertension for 20 years, but it could be prevented because it's a toothache. They give them pills saying it's hypertension, but nobody is saying, why don't you go to the dentist and get that rotten tooth taken care of?
Literally, Jay, just talking about how critical and important dental health is to your overall well-being. I was literally just having that conversation today, but there's no hooking them and crooking them if you fix the problem. So, yeah, I totally agree with a large portion of what you said in terms of the exploitation of our citizens instead of making sure we have a healthy citizenry. Go ahead, Jay.
Oh, and affordable healthcare, I do agree with you, was a joke, because all it did was tax the working class, which is already taxed. And they used the working class as an excuse to have the affordable healthcare, but they were the ones who was taxed with the Affordable Healthcare Act, because those were the ones who were uninsured. The 30 million were working class, not the poor or the rich. It was the working class. And then they taxed them. How do I know that? Me and my wife worked 2 separate jobs. If she denied health care that her job offered, I was charged for bringing her on my insurance, and she was also taxed for not taking advantage of that, even if the family coverage made more sense.
Yeah, man. Firsthand, I witnessed a number of people really lose it because they really could not go to their doctor that they had went to for 20 and 30 years. That deal just gave a bunch of new clients to the healthcare industry and made some corporations a lot of money, and still does, because the rub was what you said. You actually got a penalty if you did not have healthcare at a certain period of time during that phase. And, it got super politicized. But my whole nuts and bolts of it primarily was, you don't give people a new bill before you give them any more money. So if you're not going to address income inequality and then you're going to give people a new bill, how does that even make sense to become a thing? But we're not going to tear it down. I get exhausted talking about some of my feelings towards past administrations. I think people know that in the space that come here. So I'll keep it light for Lindsay. Let's say, Meryl, you got anything you want to add before I let Lindsay have the last word?
No, other than just appreciation for us being able to kind of have these conversations, and for Lindsay and Jasmine for continuing to do the project, and leaving Rockingham County was something that I think folks will be able to have access to.
We lost you for a moment. I think you're rattling. Your microphone was something.
Oh, what's it doing now?
That's better.
Okay.
It's better. I think something was moving.
I think I was fumbling with my headset because it was doing something weird. But no, just at the end of the day, just like the conversation that we had with School of Nursing was like, we wanted to have Rockingham County have some tools, some information that would lead to just better outcomes for the county. So I think this will happen. So I'm just appreciative.
I echo those sentiments. I think a lot of what NC 100 purports itself to being has to include this type of work.
Right.
I think it's not just always, I say this, and we work with youth, but it's not always about the young. You can't always make everything about the kids. Sometimes it's about the adults and the older people and everyone else. And this is something that I think is critical. And I think you'll be helpful in getting some people to understand that it's in their best interest to go get some help, whether they think they need it or not. Checkups mean something. Go find out everything's all good. Lindsay, I have greatly appreciated your time in this space. I hope you can join us again some other time, but I'm going to leave you with the last word before we sign off.
Thank you so much for letting me be here. I was actually here last week and I enjoyed it so much. I was just supposed to kind of pop on and see what it was about, but I sat here the whole time and listened to it. And I just, it's so great to hear your perspective, honestly, because I don't get to hear it enough. And I think these are really important conversations to have and really important voices to hear. So I appreciate what you're doing and letting me be a part of it. I also know how annoying surveys are because I went to Dick's yesterday and bought some new shoes. And the girl helping me out was like, I was like, thank you so much. How can I tell your manager? She was like, will you take the survey? And I was like, no, I will not take that survey. So I understand that this is not something that people want to do that they find enjoyable at all. But I think that the information that we would gather from it would be really, really helpful in terms of meeting people where they are. I am particularly interested in the question regarding what we can do better, how we can rebuild trust for those that have lost it, for those that are sort of teetering on it. Like, what can we do as providers to let you guys know that we really are looking out for your best interest, even though I know sometimes politically it doesn't seem that way, but healthcare professionals, we don't go into this because we want to make a lot of money, because it is really stressful and there are much better ways to make a lot of money. We could have been like bankers or something, or even real estate agents, but I think that everybody sort of goes into it wanting to help people. And the best way to do that is to know where people are coming from, the reasons why they feel the way that they do, and then what we can do on our end to help sort of combat years of destruction through this history of racism and the stuff that we were talking about before. So take the survey. It would be so helpful. We'd really appreciate it. And if you guys come up with anything that you want to reach out to me, I can give you my email address. If anybody wants to just email me separately and kind of share their thoughts on mistrust and if they've ever experienced anything and what we can do to sort of rebuild trust, that would be great.
Well, I'm going to say I appreciate your compliments earlier, and I'm glad you stuck in there. I think it's 2 weeks ago at this point, but at the
2 weeks,
yeah. Come back and join us anytime, whether it's on air or if you're just watching. We welcome any and everyone.
One more thing I want to share before we get out.
Okay, any and everyone. And real quick, just to highlight this thing called irony, because I don't get to get good examples every time because people confuse irony with coincidence. But the irony of you not wanting to do that survey when you are here pushing a survey. I love it. I love it. So that's wonderful example of irony. Go ahead, Meryl.
Just real quick, in the spirit of getting the information out and the survey out to more people, I think Jasmine and Lindsay, and I know Jasmine, I've been trying to get her connected to Brother Aman Muhammad. The 24th annual Black Family Day is going to be all virtual in Rockingham County this weekend. And I believe that you're going to be sharing the information with that group too. So anybody who's listening to us that have been fans of Black Family Day that Brother Muhammad puts on every year, all virtual this year. I think it's going to be Friday, Saturday, and Sunday. I know there's going to be more information about the survey on Black Family Day airways. So,
well, that's great to hear. On Facebook is what he said last. So yeah, that's great to hear. And the more people that know, the merrier. That's the honest to goodness thing. Look, this has been an awesome, informative evening. Lindsay, I think you and Jasmine are on to some really good work, and I wish you well on completing your thesis. I'm sure if you are a little patient with people on this survey, you'll get enough feedback and enough information to get this thing wrapped up. Jay, always a pleasure. Appreciate you joining us. Meryl, y'all guys have a wonderful night. Take care. I think I don't know. Did we lose the wheels of steels? Did we lose them? So anyway, you guys have a wonderful, wonderful evening, and thank you, Lindsay, and thank you, Jasmine, for joining us this evening. Wonderful information. Really appreciate it.
Thank you so much. Thank you.
Right. Take care.